Hi everybody, welcome to the podcast series on innovative healthcare solutions that are sponsored by the Conference of Consulting Actuaries. Just as a reminder, these podcasts are really a series of interviews that we do with professionals focused on delivering innovation in healthcare. They're really offered to provide insights on what's really happening in the changing of healthcare, the healthcare environment today. My name is Ed Pudlowski. I'm president of Morningstar Actuarial Consulting. I'm also chair of the CCA's healthcare community. I'm happy to be your host here for today. We're at the beautiful JW Marriott as part of the CCA's annual meeting. So I'm happy to be joined today by Jocelyn Harrington, who's the national spokesperson and vice president of strategic partnerships.
Yes.
Okay. At the advisory board, or at advisory board, right?
Yes.
You took out the front from it. But anyway, thanks for being here today.
Thanks for having me.
All right, so Jocelyn and I did a session earlier where we were talking about AI in healthcare delivery. And so I thought some of her insights would be very interesting to have and share with you all today. So maybe first for our audience, I think when we talk about artificial intelligence, it means something different to everybody else. And I thought you did a great job of kind of framing that. Could you just kind of give that overview again?
Sure. So artificial intelligence is sort of a buzzword of the last 3 or 4 years. So it's important to understand what we mean when we talk about AI. It's essentially an algorithm, right? Algorithms have been around for thousands of years, but this is a decision tree or actually we'll call AI, the current version of AI that we think of generative AI as sort of a hyped up, supercharged autocorrect. It is using past patterns to predict the next word, the next pixel, the next sentence in a product. And when we think about different types of AI, they range from robotic process automation all the way through to generative AI, which has been in the headlines the last couple of years.
Yeah, so the session that we focused on how artificial intelligence is having an impact on the delivery of healthcare services.
Yes.
And you did a really good job of kind of talking about what are the possible uses of AI within the healthcare environment. Do you want to touch on that a little bit?
Sure. I mean, a lot of folks may not realize it, but AI is having an impact on the patient care journey at every step today. And that's only going to accelerate and expand over the next years. Everything from patient triage. So imagine you pick up the phone to call your doctor's office and there's a chatbot that walks you through, asks you some questions to figure out where to send you. That's AI. It's natural language processing, hearing what you're saying, translating that into something that the computer can understand, and then providing you with a response back. We use natural language processing in documentation for clinical notes now, where sort of the Alexa for healthcare will listen to your patient encounter, write the doctor's note, and then the doctor just has to read it and sign off, which is always going to be faster than actually generating the note themselves, and saves a ton of time on something physicians really don't like doing. All the way up to diagnostic applications. So through computer vision, computers have read thousands of chest X-rays and know what a normal chest X-ray looks like. So if you're running a diagnostic imaging practice, you can run all of your X-rays through an AI. It will throw out all the ones that are clear and highlight the ones that are not clear and make sure that a human actually sees those. It saves a ton of time, opens up more capacity for capacity-strained organizations to be able to provide care for patients.
And where do you see the biggest opportunity for AI in healthcare?
Where most organizations are really focusing their efforts right now is around the clinical workflow, trying to find ways to expand our capacity by taking the simple, easy, but necessary tasks off the plates of the clinician and smooth that workflow, make it easier for the clinician to get their job done. If there's something that is a repetitive task, it's ripe for process automation, and then we allow our humans to do things that only humans can do.
And you talked a bit too about trying to identify potential emergency department visits in advance to try to avoid them and basically not only provide better quality care to individuals, get their treatment when they needed it before it becomes an emergency, but also to help kind of control the costs within the healthcare system. Can you,
Sure.
you had a very specific example, and I think it'd be great to share that.
This is a case study that comes out of Geisinger in Pennsylvania. They have been leveraging their clinical data to inform the process, the workflow of their case management team. And what they wanted to do was to identify patients who were probably going to have an avoidable ED visit and find ways for the case management team to get in front of that to prevent the avoidable visit. So the example I will use here is, let's say you have a patient with congestive heart failure. It's a chronic illness that can be managed through medications. Through Geisinger's data, they are able to identify the patients who have congestive heart failure, identify those patients who have prescriptions for medications that help them manage that condition, and if they realize that a patient has not filled that prescription, or the prescription has been filled but not picked up, that will flag the case management team to then reach out to that patient and say, hey, you have a medication that is ready and waiting to be picked up. Is there a reason you haven't gotten it? Can we help you get it? And what they're trying to do is get the patients to do better medication adherence and therefore prevent those avoidable ED visits for an acute exacerbation of a chronic illness. Through their efforts, they've been able to increase the number of cases that their case managers can review by rather than having case managers dig through cases individually, manually. The AI now surfaces those cases that are that need actual humans to review them. The case manager reviews it, reaches out to the patient, does that intervention. As they have grown this program, they've seen a 10% reduction in avoidable ED visits, and that's really a promising sign.
Right, and so not only are we seeing a potential for a reduction in healthcare costs, we talked about the improvement in quality care because these patients are getting the care that they need, but I think we also talked about the fact that we've targeted now probably the group of people that really needs this. So bringing in artificial intelligence allowed us to get to the right people at the right time, as opposed to kind of relying on humans to kind of do this, right?
Right. Well, and it allows us to get in front of the patients who really need it, rather than going through every single patient.
Yeah. And I think we were also talking a little bit about how this can help with disparities in the delivery of care. Correct?
Yes, definitely. So there's another case study of a health system out in the Denver metro area where their mission is to help Denver be the healthiest city in the country. But they are able to use their data to identify zip codes or neighborhoods where there might be food deserts, or areas where folks may be able to get canned food but not necessarily fresh fruits and vegetables. And so this health system, based on that data, has now developed a program where they partner with local grocery stores to take truckloads of fresh fruits and vegetables out into these communities. So they're helping to fill that need.
Great. And we also touched on in the presentation that this is AI is being used to really help the physicians become better educated and faster. Yes. And you threw out a couple, I thought, very interesting statistics about the doubling rate and half-life of information.
Yes.
Would you kind of share that with the audience?
Yeah, so when we think about the body of medical knowledge that we have, there's a term, the doubling rate of medical knowledge. So how fast does everything that we know about medicine double? And currently that rate is every 72 days. Every 72 days, what we know about medicine doubles. And the other important number to know is the half-life of that information. So how long does it take before half of what we know about medicine becomes obsolete or outdated or proven wrong? And that number currently is 12 to 18 months. So if you think about how rapidly information is coming at us and how quickly we are replacing that information, it becomes literally impossible, and I'm not using that word in the euphemistic sense, but it literally is impossible for providers to stay on top of all of the information and all of the innovation. And so the AI and technology is no longer a nice to have, it is an actual critical part of the care team, because it that can help clinicians stay on top of new therapeutics that are emerging, help them apply them to the correct patients, help them predict what kind of outcomes they can expect. So this is a real innovative movement in healthcare.
Yeah. We have a saying within the actuarial profession that AI won't replace actuaries, but actuaries with AI will replace actuaries without AI. Is that kind of applicable when it comes to the provider community as well?
Exactly the same. Yeah, we have definitely heard some hand wringing from some providers thinking, AI is coming for my job, they're going to replace me with a machine, and if you touch patients, we really don't think that's going to happen. We don't have enough providers as it is today, so really what we need to do is use the AI tools to expand the capacity of our human workforce.
Great.
Yeah.
Well, I really appreciate you being here today. I always end this with kind of asking one last question, and that is, if you didn't get involved in this business, in this role, what would you have done?
If I wasn't in healthcare, what would I do?
Yeah. What would have been kind of more your other passion, if you will?
Well, so I often tell people I'm not really a healthcare consultant, I'm a professional traveler.
Okay.
Because I spend so much time on planes. But I think actually if I wasn't doing this, I would probably be a travel writer,
wow.
Literally a professional traveler.
Wow, I should connect you with my daughter. That's what she does as
really?
a secondary business.
Oh, that's cool, yeah.
Great. Well, thank you for being here again.
Me.
This was a lot of fun. Really appreciate the audience here for listening in, and if you want to continue discussions about this and you're a member of the CCA, we can do this within our healthcare community forum. If you're listening to this and you're not a member and want to become, just reach out to our website at ccactuaries.org, and you can sign up real easily there. So thanks again.
Thank you.
Thank you.